is Michelle Austin. I will be doing an assessment of the ears, nose, and throat. Can you please state your name?
Patrick Austin.
And can you please give consent for this video?
I consent to be recorded for this video.
Okay, so I am doing an assessment for my Rowan class, my Rowan Health Assessment class, and we are going to begin with the subjective data, and we're going to start off with your ears. Just a couple of questions for you. Do you have any ear pain?
No.
Wonderful. Any infections as an adult or a child?
No.
Good. What about any discharge from your ears?
No.
Great. Any hearing loss?
No.
Wonderful. Now, what about where you work? So I'm kind of assessing and asking questions about the environmental noise. Do you work in a place where it is too loud?
No.
Okay, so if you ever do feel that you're working in a place where it's too loud, you want to use ear buds, ear phones, or you can always, just kind of remove yourself from the area. The next question is, what about any ringing or crackling noises in your ears?
No.
Tinnitus? Okay. Vertigo. So that's basically, have you ever felt like the room is spinning or yourself is spinning?
No.
Wonderful. So what about how you clean your ears? We always like to ask patients about your daily routine as far as cleaning your ears. Do you use any thing that you would poke in your ears?
No.
Wonderful, like Q-tips or anything like
No.
that? Wonderful. Okay, so I am going to wash my hands first, and then we're going to do some objective data and take a look at your ears, okay?
Okay.
All right, wonderful. Wonderful. Now that my hands are nice and clean, I want to start by inspecting your ears. Okay, great. Let me look at this side. Wonderful. All right. Okay, so basically I'm just looking at the size, the shape, your skin condition, and the tenderness. I want to look at the inside of your ear, at the auditory meatus. Great. Okay. Wonderful. Looks like you're doing a good job cleaning your ears, Mr. Austin.
Thank you.
Very nice. Nice job. Okay, so basically I'm going to do another test. It's called the whisper test. So I'm going to whisper something in your ear, and just please tell me if you can hear me.
Yes.
What did I say?
Apple.
Great. What did I say?
Orange.
Very good. Your hearing seems to be working properly. Now we are going to go to the nose, mouth, and your throat. Some subjective data, again, is just basically asking you some questions. Have you ever noticed any discharge out of your nose, like frequent runny nose?
No.
So what about frequent colds?
No.
So, just the normal, regular colds. Like, how frequent do you think that you would normally get colds?
Once a year.
Great. So what about any sinus pain, like postnasal drip, any sinus pressure? No, wonderful. Now what about any trauma to your nose?
No.
Have you ever had, a blow to your nose, or playing sports, they knocked you in your face, or any fights as a kid?
Maybe
Boxing?
Once.
Did they hit you in your nose?
Maybe once.
So you had trauma to your nose?
No.
No, okay, great. What about any nosebleeds? Epistaxis, any nosebleeds?
No.
Great. What about allergies? Do you experience any allergies, hay fever?
No.
Okay. What about any changes in your sense of smelling?
No.
Okay. So now we're going to just ask you some questions about your mouth. Any sores or lesions in your mouth? Your
No.
gums, any bleeding gums?
None.
What about any sore throats? I know like the normal colds, you do experience sore throats here or there, but anything frequent? How often do you feel like you get sore throats?
Not often.
Okay, all right. If you get sore throats at all, I'm sorry, I don't want to assume.
No.
So we talked about the bleeding gums. So now we're going to talk about any toothache or tooth pain.
No.
No. Okay, wonderful. So any changes in your voice, any hoarseness that you experience? Any changes in your voice?
No.
Okay, great. So any difficulty swallowing? We call that dysphagia.
No.
So you have no problem swallowing your food?
No.
Okay. And then basically, do you smoke or do you drink alcohol?
No.
Okay. And then just basically, I just want to ask you about your normal routine as far as brushing your teeth. Do you brush and you floss?
I do.
And how often do you say that you brush and floss your teeth?
Twice a day.
Okay, wonderful. Very nice, Mr. Austin. So now we're going to do some objective data again as far as, your nose, mouth, and throat. I'm going to wash my hands again. Thank you. Give me a second. All right, so now we are going to look at the outside of your nose. We're just checking for symmetry, making sure everything is nice and straight. Wonderful. Just going to use my light again just to kind of look inside your nose. Can you bend your head back a little bit for me? Great. Wonderful. Everything looks good. Okay, so now I'm just going to kind of feel the outside of your face, your sinus area. Let me know if it hurts at all. Any pain? Let me know if I'm too rough. Okay. All right, so now I want to look at your mouth and your lips. Okay. Great, and I'm going to ask you if you could just open up your mouth for me. Ah. Stick out your tongue. Lift it up for me, please. Turn it to the side. Wonderful, to the other side. Great, and I washed my hands, Mr. Austin. If you could just, I'm just gonna pull. Sorry. Open up again. Say, ah. Okay, wonderful. Okay, and I just wanna look at your throat just a little bit more. Wonderful. I don't see any patches in the back of your throat. I don't see anything that looks red. And as far as your gums, I don't see any bleeding at all. Wow, it looks like you must have just went to the dentist. It looks really good, Mr. Austin. All right, wonderful. So that actually concludes or finishes up with my assessment of your ears, your nose, your mouth, and your throat. I do appreciate your time, Mr. Austin. Thank you very much.
Thank you.